Okay, part 4 of our interrogation of H-Freeze.
I don't think he signed up for this.
Right, he didn't. But, he represents our youth vote, and we really want to hear what he has to say. So, starting at part 4, I want to hear what are your thoughts on healthcare, what the government's obligations are, and where you think it should go.
Well, for starters, I'm not going to be the ones to say that I believe we should have free healthcare.
Nothing's free.
Well, nothing's free.
Right.
And the greatest argument I have with people who say that we should have universal free healthcare is look at Canada. Their healthcare.
Most of the developed world. It's not just Canada, dude. It's most of the developed world has some form of government-provided healthcare systems.
But a lot of people don't know they suck.
But what sucks about it?
And bring receipts, because I think you're about to say something, and I'm going to call you out on it.
Alright, let's give my receipts.
Yeah, this is the one setup that, I actually think that I really want to change your perspective on. There's never been anything that you've said that we've talked about in any of these parts in this series. But when people talk about healthcare, and I know that you immediately brought up Canada, some of the talking points of, MAGA and conservatives, they talk about the wait times. They talk about...
But they ain't giving it away. I was going to pounce on him for that.
Right. No,
I was waiting for that shit to come out of his mouth.
But we're not here to attack this guy. We're not here to attack this guy. But I just want to head it off.
Well, my argument wasn't even going to be the wait times.
I'm still waiting on it. As you sit there digging in your phone.
Quit digging in your butt, twin.
Quit digging in your butt, twin!
Anyways, I just wanted to say, start off with the shortage of family doctors, overburdened emergency rooms, and staffing shortages, which we do have, particularly in rural areas.
This ain't Canada.
I'm just telling you why universal healthcare is bad and why they're struggling over there compared to us.
You're talking about...
Even though we do have a nurse shortage...
We have an everything shortage here. And we pay more than any other nation on earth for the shit that we have.
Yeah, our healthcare is still better.
How?
That's one thing I have to call you out on and say...
Our quality of healthcare is some of the lowest in the world.
Right. When you actually talk to a Canadian, they're going to tell you that the only waits and the, red tape that they have to go through is elective care. I'm a heart patient, and I literally went to make an appointment the other day because I bird dogged on the fact that this dude wanted me to do a follow-up from a massive occlusion that I had. And it was 6 months. It was literally 6 months for me to get in to a heart doctor. Now, I was able to tell him, hey, I screwed up. I thought I was going to be able to get in quicker. This is a follow-up from, a massive occlusion, hospital stay, and all of these things. And they got me in within 2 months.
I've been trying to see a neurologist since September. The closest appointment I could get was February. One of the talking points of wait times that Republicans like to bring up, they can, for some reason, refuse to acknowledge a thing called triage.
Yes.
You will be seen in the order of the severity of your injuries or need. They still have private insurance in Canada. You can carry your own insurance up there.
Oh, there's Canadians that come over here for healthcare.
Now, one of the things that they have is usually your rooms are not private rooms. There's going to be a second bed in there. I don't know. We have that here in the States, but you can pay extra for a private room. Nations all over this world. I mean, I think it's us, like 2 others, are the only developed nations that don't have universal health care.
Right. Well, this dude got one sentence off talking about how...
Yeah, that one sentence derailed this whole...
No, it did. And because it was derailed from the get-go. And, this is one of those things where I believe that our youth have been led to believe that this is something that could not happen here. We are literally the only country in the world.
We've got generations that have been misinformed on our healthcare system. Every single president from the 1920s to Donald Trump has tried to bring in healthcare reform. Obama was the first one that actually got
it. He got something done.
Yeah.
But yeah,
it was neutered, but
yeah, but yet now it's, so unaffordable, and they just want to take it back to they just want to let it crash, basically.
The cost of healthcare has increased every single year without failure since 1929.
True. My only talking point on that whole thing, and I wanted to hear what he has to say about it.
I would like to hear what he has to say about it, but he said like one sentence and started throwing stuff
right.
at me.
And we jumped on it. We jumped on it because it's truth. And the bottom line is we're literally the last country on the whole entire planet to actually offer a bottom line health care for our people. So I want to know, since you never even got out of the box, H-Freeze, with your point on healthcare, the fact of, we're the last country on earth to offer basic healthcare for our people. We're the last country, although, there's a lot of patents that were given up just to provide these things for free. As Americans, we know nothing's free. We know that this is paid for by the tax dollars. We get that. That's a talking point of whatever. But why aren't we there? Your generation's take on healthcare and what is supposed to be supplied, what's not supposed to be supplied. You said there's a negative of it. We want to know, and we won't cut you off this time.
I don't know, because if you think about it with the younger generation, it's very, we're kind of in the middle about everything that has to do with healthcare. Because there is an argument for us that, why don't we have universal healthcare?
Right.
And that's always going to be the argument no matter what. But some believe we could have it here, but then some believe we can't with how much we price our medicines and all that. Like how we price insulin, for example.
Okay.
My opinion, that's way too expensive than what it is to manufacture.
Which is one of the reasons why he went to prison.
Well, yeah.
I'm not trying to cut him off.
No.
Farmer Bro.
No. But
you know about Farmer Bro, right?
But you're not cutting him off. The thing it was my understanding that the guy that actually came up with insulin and that figured out insulin, using part of our, laboratories, government funded, founded insulin, which was a breakthrough. I mean, a huge breakthrough in medical field. And he turned around, he sold it back and sold the patent back for $1. Just so that it would be available for everyone in the world. Am I wrong in that?
You may be thinking about Salk. I was referring to Farmer Bro. He was the guy who purchased the company that manufactures it and just jacked up the price through the damn roof.
I get it. I'm talking about the guy that actually patented this and literally gave it back to our government for nothing because of what it brought back to healthcare.
A lot of this stuff's been given right back.
Right. Because
penicillin was given right back.
We funded, and maybe it's penicillin that I'm talking about.
That's Salk.
But these are things that were government funded through our tax dollars that were founded that should have immediately went back in. I mean, give it to Medicaid.
Well, look, you were a Bernie supporter, and Bernie was the one trying to rein in the price of pharmaceutical drugs because they literally are just charging whatever they want. They lie through their teeth claiming that it's to recoup the cost of R&D, but their cost of advertisement is like 3-4 times what the R&D cost is. Right. They spend more money advertising the damn pills than they cost coming up with it. And they just charge whatever the hell they want. And he tried to rein it in, and Trump just literally in the past few months, maybe, where all that is gone. They can go back to charge whatever the fuck they want.
Well, we've already had 2 presidents since Bernie was around, so I'll give you that. But I also want to know, H-Freeze, what is your thoughts on pharmaceuticals and prescription drug companies actually having commercials and marketing their product? Do you think that any drug should be marketed?
Do I believe they should be marketed? I really don't think so. Like, what's a good example?
Ozempic.
Yeah. Ozempic.
What do you think about Ozempic?
Really? Well, from what I heard, it's really good, but then there's also, I heard there's an argument about the long-term effects of it.
Right. Now, what is your understanding of what Ozempic was even made for?
Well, I heard, because I really haven't looked into Ozempic that much.
And that's fine. That's great.
I heard it was mainly, to be a substitute for insulin.
Okay. So you're right. I haven't looked into it much, but I do know that Ozempic had nothing to do with weight loss. Ozempic had everything to do with managing diabetes and diabetic. So Viagra. What do you think about Viagra?
To boost testosterone.
Is that what it was? It was my understanding that Viagra had to do... What is it?
So blood thinners to help cardiac patients.
Okay, I was going to say, I thought this was all about regulating blood pressure and things like that. But they found this byproduct, this after effect that Viagra had, and they're like, oh, wait a minute. We can make a shit ton of money because it makes your dick hard. Period.
We subsidize that, by the way, but we don't subsidize birth control.
Well,
I just wanted to point out the oddity in that.
Because, the advantage for women that it has is very minimal. I know in my case it is.
It's all pro-birth. That's what it comes down to.
So, and what it comes down to is, that's what I was asking. What your thoughts are on marketing these products.
We might as well call this the Amtrak interrogation because we just keep going off the rails on this.
No, we do.
Young man can't get an answer out.
But he does. And I think a lot of those things are, just kind of shows what the mainstream gives everyone. A lot of the answers that he's given aren't necessarily his fault as of what he knows about it, because he didn't care about it before. He didn't care about it. He didn't care to look into half of this shit because it didn't matter, because he's living his life. He's a youngster. It's what it is.
He doesn't need that universal health care because his bones don't scrape. His organs ain't failing.
Right.
Fuck you and your youth.
Yeah. And, those of us that are living it, Viagra is a great part of my life. I'll tell you that right now. Never thought I would ever want it or need it, but here we are.
Freaking Blue Chew helps a lot, man.
Yeah, Blue Chew is the shit. I've never had it, but I'll try it. I'll take it.
Because I seen the ads for that, and it's like, oh, it's all natural, holistic, and they're like, that's just like over the counter stuff.
They also have this hemp product for your hair.
Oh, what now?
Hims. It's for your hair.
Have you tried Blue Chew?
Yes, I have tried Blue Chew.
How'd it work?
Right. Now Hims is what I use. And Hims, hers, whatever, and they got all kind of stuff. They'll give you Cialis. They'll give you Viagra.
Chocolate.
Who is they?
Huh?
Who's they giving out all these pills?
They.
Man, you said they'll give it to you? Like, hey.
Yes, Hims. Hims, hers.
Oh, okay, yeah.
Just like you said, Blue Chew, all of this.
Yeah, the advertisement on TV.
Yeah. It's not like there's a dealer across the street.
Yeah, I'll tell you right now.
I'm drunk.
I have a subscription.
My shit ain't working. My brain is not functioning right.
I have a subscription for
like, who the fuck is him?
They give me sildenafil, which is the generic Viagra. Whether you need it or not, it's a fun time. I'm telling you. Look, he's 20 years old talking about he loves Blue Chew because guess what? He don't need it.
He was 19
when he does
3
take
hours
it, he
ago.
has a good time with it. That's what it comes down to. So sorry to chew you up over that. I know we didn't let you get a word in, but yeah, on the healthcare thing, that's just what it is. And, I challenge you to actually look into more of those things. with healthcare because we are not any better than Canada.